Welcome to the Wow MD podcast, where in each episode you will get in 30 minutes or less valuable pearls about holistic wellness, anti-aging, hormone therapies, beauty trends, and other facts you should know about our medical healthcare system and your health that no one is telling you. My name is Dr. Mirala Chernayanu. I am a conventional board-certified OBGYN physician who, after the loss of my father due to a careless and uncaring medical team, decided to retrain and seek certification in anti-aging and restorative therapies. What I know, I am happy to share with you. Hello, listener. This episode is about IV vitamin therapy. I'm continuing to talk about IV vitamins. In the past episode, I reviewed the primary medical condition or circumstances where someone might need to get an IV vitamin therapy, why IV vitamin therapy is beneficial because so many people suffer from digestive issues. In this episode, I'm going to talk a little bit more about the details of vitamin therapy, how to administer it for how long, and talking a little bit more about the vitamins themselves. And I want to talk about why insurance covers in some cases and what insurance exactly covers, as I am a practice that does bill for infusions, but more information to come on that in a little bit, probably in the next episode. This episode is mainly about the vitamins. They are taking center stage. To start the episode, I really want to address a little bit about how long does an IV vitamin therapy last? Well, it's about 60 minutes. There are faster ones where you have very little fluid with a couple of vitamins in a small bag. Those can actually go over 20 to 25 minutes. But if you have a vitamin concoction that has more than a few vitamins, then you probably need to dilute it with some bicarb to establish the pH, the acidity of the bag, so it doesn't irritate the vein. And you need to run it a little slow. Sometimes patients want to rush and get out of there, and they're asking, how fast is this going to go? Can I get it faster? I know I can tolerate it. There's no issues. Well, again, the exact duration of an IV can vary. It depends on the type of the infusion. It depends on your health condition. Depends on the clinic procedures. And again, some clinics might offer longer sessions if you have multiple vitamins or multiple treatments administered. Do not push for rapid infusion for the sake of time and convenience. Come in, sit down in the infusion chair and relax. This is your time to get better, right? How often do you need IV vitamin therapy? Well, it depends on your individual health goal, your needs, and overall what's your health condition. Now, some people might need to receive treatments weekly at the beginning and then space out to biweekly, and some people just need something once a month. If you're using IV therapy for very specific wellness or performance goals, like the hydration, your energy boost, recovering from something, then obviously you're going to get the IV infusion when you feel you need it. If you have a specific medical condition, well, that might require more frequent treatments based on the medical decision and under medical supervision, right? If you are stressed, if you travel, if you've had some intense physical activity or a severe infection that you have difficulty recovering from, well, that might influence your decision to have IV therapy right then and there, right? But always consult with the healthcare provider. And one of the problems when you go to an IV infusion bar, you're not going to get a doctor. It's going to be a nurse. It's either an LVN or an RN. They're not even a family nurse practitioner in most cases. They probably don't have any knowledge on specifics other than very general things about how not to get in trouble with the infusion. So maybe have a consultation before you're considering an IV infusion. But like I said, I want this episode to be about center stage, about the vitamins that are available. And I'm actually going to split them in two because there's a lot to talk about. And in this specific episode, I want to talk a little bit about the vitamins that are actually covered by insurance companies. So when you go and get a vitamin infusion, some of your vitamins might actually get covered. And I'll be a little bit more specific with what insurance might cover, might not cover. But before we go and dive right in, let me talk a little bit about what exactly is a vitamin. We talk a lot about vitamins. We hear about vitamins. The official definition is that the vitamins are an organic compound essential for normal growth and nutrition, which is required to be present in small quantities in our diet because our body either cannot make it in the amounts that are necessary to sustain our health and needs it on a regular basis, right? So by definition, we need these vitamins to be introduced into the body from the outside, most likely from our diet, but also obviously from supplementation. I mean, raise your hand if you're not taking vitamins. Everybody's taking vitamins here, right? You would be an outlier if you do not. And these vitamins perform a variety of roles in the body, from supporting the immune system to helping repair our tissues, facilitating the production of energy as antioxidants, helping us to detoxify and continue to thrive in this unfortunately toxic world that we created for ourselves. So to make it super simple, vitamins are either water-soluble or fat-soluble. The water-soluble vitamins include vitamin C and all the B vitamins, okay, from 1 through 12. Now, you might not know this very important fact. These vitamins, the water-soluble vitamins, that's vitamin C and B vitamins, are not stored in the body. They must be consumed regularly from your diet. That is a very big problem, especially with B vitamins for anyone who decides to do a vegetarian diet. The majority of our vitamins are actually in meat and meat products. And you're going to say, well, what the heck? I'm just going to take a B complex, right? Or a B12. Well, you will need to, and you will need to for life. This is not something that you can do 3 days on, 3 days off. This is not something that you decide to do for 2 weeks and then stop. You have to commit to this if you are committed to a vegetarian diet, right? Fat-soluble vitamins are vitamins A, D, E, and K. These vitamins can be stored in the body's fatty tissue. They can be delivered when they're needed from the fatty tissue, and they can be utilized as the body needs them. So the body can bank and store these vitamins, right? Let me talk about the B vitamins. We cannot give fat-soluble vitamins intravenously. So they tried to give vitamin D IV in high doses during COVID. The data was not very reliable, but you can nicely inject vitamin D intramuscularly. You can inject vitamin K intramuscularly. Vitamin A and vitamin E are available in the diet and as supplements. So we don't really inject those vitamins very often. But I'd like to talk about the B vitamins in this episode. Why? Because we cannot live a normal life without these vitamins. It is important for you to be aware of what they do and how a deficiency of a specific B vitamin would manifest. So I'm taking you to school a little bit, right? If you don't want to know about the B vitamins and how they can help your body, well, then shut me down and listen to the next episode where I'll talk about the next stuff. But we literally cannot thrive without these vitamins. Now, the majority of these vitamins are available in the form of supplementation. But as I spoke about in my last episode, 2/3 of adults and probably children in the United States and probably worldwide have some form of digestive issue. So even if you have a healthy and balanced diet, you might be deficient in B vitamins. You might not absorb them. So you think, okay, well, I don't really care. I'm just going to take a B vitamin. But even taking an oral B vitamin or a B complex to supplement your levels, it could increase the availability of the vitamin to some extent, but if you introduce it into your digestive system orally, by mouth, it will be subject to the same limitations that make the extraction of the B vitamin and the transport of the vitamin from the digestive tract into the bloodstream a problem. Your digestion is still a limiting factor. So if you have digestive issues that limit vitamins and nutrients absorption, you can't get them from your food, even though your diet is perfect. You will have the same problem when you actually take oral supplementation of vitamins. Now, here's where intravenous administration of B vitamins can be miraculous in its benefits. And this is how intravenous B vitamins can be miraculous for neurological disorders and the correction of fatigue and weakness and improve immune system and skin health. Let me talk a little bit about each one of them. Vitamin B1 is known as thiamine, and it's absolutely crucial for energy production and nerve function. It also contributes to muscle contraction and supports proper functioning of the heart. That's the biggest muscle in your body, right? It also helps the production of hydrochloric acid, which we need to digest our foods. It has antioxidant properties, supports a healthy mood. So obviously, if you have a deficiency of B1, it will lead to significant medical problems manifested as fatigue, confusion, foggy brain, muscle weakness, and various nervous system disorders, including possible neuropathy. It exists in seeds and legumes, nuts, meats, fish, vegetables like spinach, asparagus, Brussels sprouts, many fruits, oranges and melons, and dairy product. So this vitamin is widely available in food. But remember, you have a gut problem, you're likely not going to extract it. B12 is also known as riboflavin. It also helps energy production, the metabolic function of transforming our fat, protein, and carbs into energy. It is involved in the regeneration of glutathione. That is a key antioxidant, and it deserves literally a podcast episode of its own, or a little part of one of my future podcast episodes. It supports healthy skin, healthy hair, and healthy mucous membranes. It can also assist in the absorption and utilization of iron. All right. Deficiency of this vitamin can cause symptoms like sore throat, cracks and sores on the outside of the lips, inflammation of the corners of the mouth. You easily get B12 from portobello mushrooms. Delicious, right? Nuts, seeds, almonds, sunflower seeds, green leafy vegetables, spinach, kale, asparagus, but more specifically from dairy products, eggs, lean meats, beef, fish, salmon, mackerel, etc. Let me talk about B3. It's also known as niacin. Remember, I talked about B3 a little bit and NAD being a little derivative of B3? Well, niacin, it's important for various actions in the body. Energy production, DNA repair. This ensures a normal cellular function. It is our insurance to be resistant to genetic mutations that are caused by our environment. It helps our antioxidant defenses. It can help increase good cholesterol. People take niacin to manage their cholesterol. Again, it helps our antioxidant defenses. It will raise good cholesterol, lower bad cholesterol. It can maintain normal nerve function. And it can promote healthy skin. Lots of people put niacin compounded in topical products for anti-aging benefits. Foods that are very high in vitamin B3 are poultry, fish, and meat, whole grains, legumes, nuts, and seeds, especially peanuts. So again, the Bs are very easily found in a normal diet. Now, the most severe form of vitamin B3 deficiency is known as pellagra. It is characterized by the 3 Ds: dermatitis, diarrhea, and dementia. I don't know about you, but there are a lot of people walking around with rashes, foggy brain, and loose stools. Okay? Please check your vitamin B3 levels. There is a test called Micronutrient B Complex Panel at Quest. Probably LabCorp offers it too. And have it done. Don't take any vitamins for 5 days so you can establish a baseline. You do need to be fasting, I believe. And test your vitamin B3, right? Other symptoms might be fatigue, anxiety, depression, headaches, a loss of appetite, which would lead to weight loss. It can unfortunately cause swelling in other parts of the body. There is no B4, but this term was historically used for other compounds, like choline or carnitine. But none of these compounds meet the true definition of a vitamin. So let's move on to vitamin B5. Pantothenic acid. It's a very important nutrient for the body. It helps convert our macros into energy. It is very, very, very useful for the production of adrenal hormones. Cortisol, the stress hormone, DHEA, the anti-aging prohormone, very important for those. It is involved in the production of our cholesterol and our neurotransmitters, so it can help manage our stress a lot. So pantothenic acid and B5 is very helpful for stress management. It's also involved in the formation of our red blood cells, which are what we need to transport our oxygen throughout the body. And it also promotes healthy skin by supporting wound healing. The deficiency of pantothenic acid is extremely rare because this vitamin is found in a variety of foods, like pretty much in everything. I'm not going to give you the whole list of foods, right? But deficiency of B5 is very possible and can manifest with fatigue, irritability, numbness and tingling in the hands and feet, muscle cramps, sleep disturbances, depression, persistent headaches, and an impaired immune function with a very high susceptibility to infections. Let's move on to vitamin B6, pyridoxine. Variety of vital functions for it. It's involved in the metabolism of proteins and amino acids, our ability to make neurotransmitters like serotonin, dopamine, and GABA. It helps regulate the production of hemoglobin. That's that protein in our red blood cells that need to transport the oxygen. It is crucial for our body's ability to fight infections, so it's very important for the immune system. It's particularly important for the brain development and function of the brain in developing children, and it can help reduce the high levels of homocysteine and protect our heart. And it also apparently influences the amount and quality of the sebum produced by the skin glands, so it influences our skin. If you eat a balanced diet, it's unlikely you will be deficient in B6. However, vitamin B6 deficiency manifests with anemia, which can lead to fatigue. It can manifest with changes in your skin like dermatitis, cracked and sore lips, a swollen and sore tongue. There might be confusion, depression, there might be irritability, or other various nervous system disturbances. People that are deficient in B6 will have weakened immune system, and they will have an increased susceptibility to infections, and there will be pellagra-like symptoms in severe cases. It's well known that severe B6 deficiency in infants will lead to seizures, and in adults can lead to nerve damage, peripheral neuropathy, which leads to numbness and tingling in the extremities, which can become permanent. Now we arrive at vitamin B7. This is one of my favorite vitamins. It's also known as biotin. Who has not heard of biotin? This vitamin plays several crucial roles for the body. Again, all the B's help convert macronutrients into energy, supports healthy hair growth, stronger nails, and a clear skin. It plays a very important role in the expression of certain genes. It supports nerve communication and nerve function. And it is important for the growth of an embryo during the pregnancy. So this makes it a vital vitamin. It's very available in many foods: eggs, nuts, seeds, salmon, dairy products, fruits like banana. However, remember what I told you about. Everybody's deficient in these B's because we do not absorb our foods, because our guts are messed up. So a deficiency of biotin can manifest as thinning hair, brittle nails, skin rashes, and various neurological issues, as well as metabolic problems. The next vitamin is B8. B8 is commonly referred to as inositol. You've heard of inositol if you're a woman, and you might have heard of PCOS and how valuable inositol is for PCOS. Now, here's the thing. It's not really officially recognized as a vitamin because the body can make it on its own. It helps with the formation of the cellular membranes, and without intact cellular membranes, our cells die and get sick and act up poorly. It also acts as a secondary messenger in a variety of biological processes. It can help improve mental health disorders like anxiety and depression. It plays a key role in blood sugar control and contributes to healthy cholesterol levels. It exists in fruits like citrus, beans, grains, nuts. So an inositol deficiency would look like various mood disorders, anxiety, depression, irritability, insulin dysregulation, overweight, belly fat, sugars going up and down, skin problems like dryness or eczema, fatty liver, as well as hair loss and thinning hair. So inositol is not available for IV supplementation, but it is available for oral supplementation. Vitamin B9 is also known as folate. This vitamin is absolutely essential. This is one of my favorite vitamins. It helps with the creation of new DNA, and it's very important in the repair of the existing DNA. It supports cellular division. It is vital for the production of our red blood cells, important for our cardiovascular health and mental health. Not the least, this vitamin is critical during pregnancy to support a healthy development of a fetal brain and the fetal spine. Obviously, folate is abundant in foods like leafy green vegetables, citrus fruits, beans, and whole grains. So that's great for vegetarian moms. Many of the grain products bought on the market are fortified with folic acid. Folic acid is a synthetic form of folate. Again, this could be the subject of a totally different episode. In case you didn't know, folic acid and folate are not the same. About 15 to 20% of the population of Earth has a genetic mutation that does not enable them to process folic acid. It makes them prone to develop folate deficiency. How does a folate deficiency manifest? And by the way, this is called the MTHFR mutation, right? If you have this, it will manifest with anemia, especially the type of anemia where the body produces very large and these immature looking red blood cells that do not function well. So obviously the symptoms would be fatigue, weakness, pale skin, and shortness of breath. Like you get short of breath doing anything. Folate deficiency can also create painful sores in the mouth and a swollen red tongue. It can manifest with mental health issues like irritability, forgetfulness, and depression. Folate deficiency will increase levels of homocysteine, which in their turn increase the risk of cardiovascular problems and complications. And last but not least, folate deficiency in women increases the risk of neural tube defect if they're pregnant, and in developing children, it will lead to growth problems. And now we are arrived at my favorite vitamin, vitamin B12. Everybody has heard of this vitamin. It is also known under the name cobalamin. It has several very important functions in the body. It is important for the formation of our red blood cells. We can't make red blood cells without B12. We need it for the growth and the division of all of our cells because it's involved in our production and repair of the DNA. It is absolutely crucial to maintain the health of our nerve cells and the production of myelin, which is that protective coating for all of our nerves. It's unfortunately what gets destroyed in multiple sclerosis. It is very important for normal brain function and for normal cognition. B12 deficiency has been linked to memory loss and other cognition problems. B12 helps the conversion of homocysteine to methionine. It maintains our cardiovascular health. B12 is naturally found in animal products. However, many people are meat eaters. However, the majority of adults tested for B12 are deficient. And when I say majority, I mean 90% or more, because we all have such bad dysfunctional digestive tracts that unfortunately most of us function in our day-to-day lives with suboptimal levels of B12 and all of these other vitamins I just spoke about. And what's interesting is that it is well known that as we age, our gut functions less and less well. We became more and more deficient in hydrochloric acid. There are people who take PPIs, protonic pump inhibitors, or the purple pill for heartburn or GERD, and they take it for many years. And that neutralizes your hydrochloric acid. And you have inflammation of your gut lining, and that's why you need to take it. So in a nutshell, you're not making one of the essential proteins, compounds that are required to absorb B12 later in the gut. Because in the stomach, you need the hydrochloric acid to unbind your B12 into its free form. And from the stomach, it combines with a protein called intrinsic factor. So if you have a digestive issue, any digestive issue that involves heartburn, reflux, and you need to take a medication to dampen these symptoms, you likely have a deficiency of intrinsic factor and you're likely not absorbing your B12, okay? And you probably are B12 deficient. So which ones of all these vitamins are available for intravenous use? Well, B12 is available for intravenous administration. I'm going to start going backwards, right? There is cyanocobalamin, methylcobalamin, and hydroxycobalamin. Let me just spend a few words on these. What is the difference between all of these three forms? Well, cyanocobalamin contains a cyanide molecule, which is removed by the liver. This is the least expensive form of B12. It's very chemically stable and is very, very commonly used in supplements and in fortified foods. Lots of people say, well, doc, just send it to the pharmacy. I used to pick it up from my pharmacy and I would just inject it myself. That is cyanocobalamin. Again, you have a cyanide molecule compounded with cobalamin. Don't know why. I have no idea why they decided this is the best way to have it available, but I try to stay away from that. We only have it in the office as a backup if we run out of the other two forms. The other two forms are methylcobalamin and hydroxycobalamin. Methylcobalamin contains a methyl group. So let's call it a methylated B12. It's a more bioactive form. It is readily utilized by the body. It does not need to be converted. It is the recommended form to be used in anyone who has a methylation genetic mutation, like the carrier for the MTHFR gene. So if you're a carrier and you have the MTHFR gene, the folate mutation gene, you need methylcobalamin. Hydroxycobalamin is more stable. It remains longer in the body compared to the other forms, and it's also very easily converted into the active forms. The methylated form, the adenosylcobalamin, which is another form that I'm not going to talk about today, but it's very often used because it's efficient and it has very long-lasting effects. Again, I prefer to avoid cyanocobalamin due to the cyanide molecule, and I use a combination of methylcobalamin and hydroxycobalamin whenever I have them available, okay? The other B vitamins are available as a B complex in various dosages and various formulations, and they usually will have B1, B2, B3, B5, and B6. Those vitamins will be available for intravenous administration. So there are other ingredients, but I don't want to make this, I'm pretty sure you're yawning by now, so I don't want to make this too long or too didactic. But there are other ingredients available for intravenous use. I want to talk about them in my next episode, like alpha-lipoic acid, amino acids like lysine, carnitine, glutamine, proline, arginine, etc. So come back next week if you want to know more about other nutrients available in IV vitamin therapy. And I'm also going to talk a little bit about calcium and magnesium because those are also available in an IV administration form. And when would we need them? So thank you for listening. And I look forward to chatting with you next week when I talk more about these other nutrients and why the insurance does not cover them. Everything that I talked about in this episode will likely be covered by insurance, even though the majority of B-complex vitamins are not covered, but B12, B6 might get covered up to an extent. I'll chat with you next week. Thank you for trusting me with your time, and thank you for listening to today's episode. If the content I provided wowed you, was helpful and valuable to either you or someone close to you, please do me a favor and leave me a review. I am very open and welcome any kind of feedback as well as suggestions on any content ideas, so please forward those suggestions to Jessica, my patient care coordinator, through our website, herabeautyandwellness.com. And I look forward to our time together next episode.